I wanted to begin by asking you, on the subject you pressed in your time as the Health and Human Services Secretary, where do you believe you made the most headway?
I had many successes. I don't know which one was the best, but they were all very successful, all helping to improve quality of health. And I always tell people, if you improve the quality of health, you automatically improve their quality of life.
You mentioned at the Oxford Health Alliance Summit, you mentioned tobacco and tobacco control, and you were probably very successful with that. Even within your own department, you banned smoking, I believe.
I've fought and give speeches about anti-tobacco all over America. I believe that we should regulate it through FDA. I think we should tax it, and I think we should encourage our business leaders, to help set up funds to help people quit. Because 70% of people want to quit. And so let's give them the tools to help their employees quit. That's what I did in the Department of Health and Human Services. And I'm trying to export that to every business in America. And I think if we did that, we could really have a huge impact on public health and drive down the deaths from tobacco-related illness and actually improve the quality of health. And as I've always said, that improves your quality of life.
But where do you stand on the government intervention versus personal choice debate?
You need both, especially in the area of chronic illnesses. But in tobacco, it's so addictive. And I think what I would recommend and advocate, and I do, is to put a $1 tax on every package of cigarettes in America. Just a $1. But don't give the money to the government. Give the money to a separate fund to help smokers quit. So be able to use that money, for purchasing medicines, patches, counseling, interventions. I also believe that you also have to have human responsibility. You have to learn how to stop eating in excess and drinking to excess. And that's a big problem for obesity-related illnesses, cardiovascular, and especially diabetes. And that diabetes is growing so rapidly, and it's growing so fast that it's going to consume all of our healthcare dollars unless we are willing to stand up and be able to change it. And of course, on diabetes, it's the National Institutes of Health has done an exhaustive study that found out that if you walk 30 minutes a day, and everybody can do that, and lose 5 to 10% of your body weight, you reduce the incidence of type 2 diabetes by 60%. That's a huge savings. And the third thing, of course, is there are two things as it relates to obesity, and I like to talk about, and I talk about my diet, the Tommy Thompson diet, and I hope you put this on because it really works. Do you know that, Eddie, that nobody will arrest you if you don't eat everything on your plate? Nobody will arrest you. There's no law out there to say that. So I say take everything you want, put it on your plate, but only eat 50%. If you follow the 50% rule, fill up your plate, but only eat 50%, 50% of your dessert, 50% of your main course, you will lose weight. I've lost 15 pounds, and I'm healthier for it. And I also do something that CNN has just done a report on, and now you're following up on them, and that is I hand out pedometers. And everybody should get this. Put one on here for your program. Eddie, your health matters, and watch it every day and see if you compete against yourself. It's a way of getting yourself into taking care of yourself.